Thank you, Doctor, for joining us in this case study video series. An educational initiative by Himalaya Baby Care. As India's #1 doctor-prescribed baby care brand, we strive to uphold the highest standards in every step of our journey. This case study, Differential Diagnosis of Mycoplasma Pneumonia in a pediatric patient with respiratory distress, addresses a critical aspect of pediatric pulmonology. It underscores the importance of differentiating Mycoplasma pneumonia from other respiratory conditions in children, stressing the importance of thorough evaluation and prompt treatment to achieve accurate diagnosis and effective care. We are honoured to have Professor Dr. Pramod Jog, Professor of Pediatrics and Head of the Department of Family Medicine at D.Y. Patil Medical College, Pune, with us. Professor Dr. Pramod Jog will share his expertise and valuable insights from a unique case, highlighting innovative approaches in pediatric care. Let's begin this enlightening session.
I am Dr. Pramod Jog, consultant pediatrician from Pune. Wishing you all a good day. Today I will present a case involving Mycoplasma pneumonia in children. Now, it's a common cause of respiratory infections in school-going children and adolescents, and it's often referred to as walking pneumonia. And the diagnosis is essential because the symptoms, they closely resemble other respiratory conditions like asthma and bronchiolitis. Now, this is a 5-year-old child, and the diagnosis and the treatment for Mycoplasma pneumonia was given to this child. A 5-year-old child with a history of wheezing, presented with fever and cough for 4 days, and was referred for respiratory distress. Birth and the developmental history revealed no significant pre-existing respiratory condition, except for 2 episodes of wheezing over the past year. On examination, the child basically exhibited tachypnea, chest indrawing and bilateral wheezing. The saturation was 90% on the room air, and it improved to above 95% with a non-breathing mask and oxygen. All other systems were normal. Now, based on the case history, the patient was initially diagnosed with asthma and treatment was initiated. The treatment for acute severe asthma was started in the form of 3 cycles of nebulization, IV steroids and IV magnesium sulfate. But despite this, there was no significant improvement and the distress and the fever continued. So ceftriaxone was added, but the fever persisted and the child continued to experience tachypnea after 2 days. Meanwhile, the diagnostic test results led to a definitive diagnosis. The X-ray revealed consolidation in the left lower lobe. Ultrasound showed no effusion, and IgM showed Mycoplasma positivity. Therefore, the child was diagnosed as Mycoplasma pneumonia, and azithromycin was added after confirmation of the diagnosis. And this led to significant improvement. And following addition of azithromycin, the child showed improvement with resolution of symptoms and improved respiratory status. The child was discharged and he was stable after completion of the full course of antibiotics. As we discussed, basically it's important to note that Mycoplasma pneumoniae is a known cause of community acquired pneumonia in school going children, and it can lead to atypical respiratory tract infections. And Mycoplasma pneumonia is associated with wheezing. Therefore, the treatment of children under the age of 5 with suspected pneumonia basically involves amoxicillin in the duration of 7 to 14 days. And for children above the age of 5 years, macrolide antibiotics should be administered. Overall, the presentation of Mycoplasma pneumonia infection can be similar to other lower respiratory tract infections like pneumonia, asthma and bronchiolitis, and therefore a high index of suspicion is necessary for clinicians to make the correct diagnosis. Remember, history and physical examination play a crucial role in identifying the condition, and wheezing is common in both pneumonia, asthma and others, and that's why You look at the clues in the history and clinical presentation which can guide us to diagnosis and treatment. So considering the history and physical examination is basically important for differentiating various conditions. Thank you.
We hope you enjoyed this session and found it insightful and impactful. Thank you. Himalaya Baby Care proudly launches pure cow ghee range with pH 5.5, specially formulated for baby's sensitive skin from day one, that promotes skin immunity, offers an anti-inflammatory effect, protects the skin's microbiome, provides intense moisture, deep hydration and nourishment, formulated with pH 5.5. Looking forward to your valuable prescription support for Himalaya Baby Care Pure Cow Ghee range.